Hey, I'm sitting with Dr. Simone. We're talking about eczema triggers, things that trigger off eczema. Well, I guess as a parent, we're looking to see what are the symptoms that our child might get for us to think, this might be eczema.
So eczema is typically associated with a rash that you
Right.
tend to see in the creases of the body. So the elbows, the wrists, in chubby bubbers. We can see it in the neck, under the arms, behind the knees, ankles, those sorts of areas.
Okay.
In really
Red,
raised, scaly, dry.
Okay.
Now, when we're talking about eczema, I guess, and the things that can be underlying eczema, it's important to look at the family.
Okay.
And if we know what the family history is, then that can give us a bit of a clue as to what may be going on.
So is it genetic?
There's definitely a genetic element to eczema. So eczema is genetically related to things like asthma, as well as hay fever and allergies and those sorts of things. So if someone in the family is an asthmatic, or someone in the family has allergies or hay fever, then that doesn't necessarily mean that the child will be asthmatic or have allergies, but they may show up as having eczema.
Okay, and how early can these signs come up?
So, but even newborn 2, 3, 4-week-old bubs can develop rashes that can be, is that an eczema type rash? And if there's a history of it in the family, then that makes you a little bit more suspicious of looking out for that sort of thing. A lot of other triggers can be things like exposure to dusts.
Okay.
So house dust, dust mites, those sorts of things. And so dust minimisation that's why they talk about dust covers and all those sorts of things as a prevention. Pollens and grasses, especially freshly cut grasses or certain strong pollens like wattle seed. Sometimes animal skin, so the family dog or the family cat can also trigger
And I guess you'll notice that if the child is playing with this animal, then all of a sudden they come
out in more of a rash. And one of the things that can also be related is certain foods. So some children, for instance, are sensitive to dairy, and that can cause them to have more of a prominent rash than they would otherwise have.
And it would outbreak on their skin.
And then you'd notice that if they reduced the amount of dairy that they had, then their rash would get better, those sorts of things. So being able to identify what is it for your child, and especially if there's that susceptibility, then what are the things that we can do to minimise their exposure to those potential triggers.
Great. And I think we've already talked about how we can treat eczema. So do keep it locked here at Mums at the Table for tips on like this and so much more.